This is a recent total hip replacement, and you can see the enlargement and the pressure. There's a white point there. Kind of zoom in on that if you can. I don't know if you can see it. There's not red. You don't see the red that you would think that this is infection. The patient is on anticoagulants, so we don't have to worry. We're not as worried. And I squeeze it, and she doesn't scream, so we also know it's not a blood clot. So it's a hematoma, and you can see the pressure. Now, what I want you to watch, and you can see that that it goes here. There's a little bit of exudate at the top. So there's a tremendous amount of pressure. It's rigid in an ovoid fashion here. And we're going to take the tops and bottoms of that, of ovoid, and we're going to press them together gently. And as you may see, I'm rolling my thumbs up and my fingers down, or my thumbs down and my fingers up. So I'm rolling it and I'm twisting it in 3 dimensions. So not only superior, inferior, I'm rotating it in a superior cephalic caudal axis, right? And I'm twisting it on what we would call, like, say, a frontal axis here. You want to rotate that, and you want to take the pressure out of it. So you can see that right there, or I can feel right there that the pressure underneath my fingers diminishes. And what that allows is lymphatic flow and blood flow in and out. Now, the blood flow we know is fine on the one hand, but does it get venous exit as easily as it should? No. And does it get lymphatic drainage? No, because there's a lot of extracellular fluid there, right? And it's the extracellular fluid that's in among the tissues. The gel is more watery, and that water has really developed a lot of hydrodynamic force, and we're trying to alleviate the hydrodynamic force, the force of the water in the tissue. So we have to get this out of there, otherwise it is going to get infected, and it is going to cause, it can turn into gangrene or some such thing, and we don't want that. So this is not an emergent situation, but it's a very important situation. And it's just wound, but it could go down to the joint, and the patient's not having night sweats or any other pain, any other, no other things that would make us think infection, no other things that would make us...
Just kind of burning on the side.
Burning on the side, which is a nerve thing, so it's stretching the nerves. Now, what you may be able to appreciate, or maybe not, that the size and the rigidity, the turgidity, what we call turgid, of the hematoma or the tissue. What we're doing is we're getting rid of that turbidity or that turgidity. It's not turgid anymore. And so, and again, you can see that it comes clear up to here. And remember that the lymphatic drainage is going to come under the inguinal ligament here. So we're trying to get everything to go back into the lymphatics, ephemeral lymphatics there.